wonderful results of yoga. If you are spending 1 hour for your exercise every day, walking, if you do 1 hour of yoga, it will give you 3 times more result than that. So yoga is much more effective than the just exercises and others. And you will be slowly, you will be able to reduce medication, stop medication. Hundreds of them have become normal today, regularly doing that. Then, why is it that in India we have the largest number of diabetics in the world today? People have found that we are prone to become diabetic because genetically we have got the insulin resistance highest in the world. Next comes Malaysia, next comes China and others. Insulin resistance is the one that does not allow the insulin to enter into the bloodstream. It is called the autoimmunity. So since IR is much more in Indians than anybody else, we are prone to become more diabetic than anybody else in the world. Therefore, with the lifestyle change that we are having, the whole thing is blowing up. Earlier we used to have a lot of physical exercise and we didn't have all this conveyance. Today, hardly we walk. We come from our house, we come in the car and then come over here and do all the things, and hardly any physical exercise. Earlier we used to do a lot of physical exercise. And our food, if you look at that, it has become very rich, very calorie rich, cholesterol rich. Earlier we used to have simple food, so diet has changed and our exercise have reduced and our lifestyle has changed. Sleeping very late in the night and getting up late in the morning, they start upsetting the biorhythm of the body. Because of that, there's going to be a big load on the immune system and the immune system starts crushing down. We normally have personality development camp for children. And in Prashanti, the life starts at 4:30 in the morning and goes on up to 10 o'clock. So at the end of this camp for 10 days, we asked the children, how did you feel? All children said, oh, it has been a wonderful experience. We made so many friends and such a wonderful yoga. But uncle, only thing that we disliked, what? Midnight yoga. Midnight yoga? What do you mean? Yes, normally we sleep around 2 o'clock, 3 o'clock in the morning, get up at 10 o'clock. For that is midnight yoga for us. That means you have changed the complete normal biorhythm, which is a natural thing. And because of that, a big stuff. When you have a lifestyle change, when there is an increase in insulin resistance, when you have high calorie food, all these are going to increase. So you have one side, whatever available insulin available to you, and exercise. These are the only two things. So what we do in yoga is to reduce the very stress level and take care of the lifestyle. Therefore what happens, the sugar level is going to reduce automatically. This is the whole essence compared to the treatment. So stress reduction restores immune system normalcy. Autoimmunity is reduced. We have been able to show. Psychoneuroimmunology tells that role of mind in immune system is very, very important. When the mind is stressed up, immune system gets into autoimmunity and increases the insulin resistance and causes the problem. It has been worked out in great detail. Not only in diabetes, in all autoimmune disorders like rheumatoid arthritis and thyrotoxicosis and others. What about this? Here also we have a different approach to the whole thing, obesity. Normally, when people go to any place, they give a lot of fasting and other things. And in our case, what we do is we go to the root cause, Adi. It is the Adi that makes the problem. Therefore, what we do here is that, okay, come and eat, doesn't matter, but start working with the yoga. Then things will start happening. Anything? So I remember one of the persons who was very, very fat, 160 kgs who came to us. He was very happy. The first day he came to Dr. Nagatna, our medical chief, and said, Dr. Nagatna, this is the only place where I have been told not to control your food or anything. I hate fasting and all that. I want to eat. And now he has said, eat well. So he was very happy. That morning I go there to see. He has packed about 15 idlis, for the breakfast. Lunch, he has packed up about 10 chapatis and so much of rice, eating to heart content. Everybody was serving him with great love. He ate and ate. First day, second day, third day. Then the sixth day, I just go there to see. In the breakfast, he was eating only hardly half a idli. I said, what happened? Somebody says you do not eat? No, sir, I don't feel hungry at all. But just to meet my friends, I come here. Then what about lunch? He was taking one small pulka and little bit of sabji. At night, the same thing. He never felt hungry. He stayed with us For 3 months, he reduced his weight from 160 to 85. And such miraculous change. When he went back, people could not believe it is the same person who came. And that is a wonder. So, we have measured, when you do this, once you handle the adi, the craving reducer, then you don't feel like eating. So, what we measured is, as you could see, the weight has reduced, BMI has reduced, oxygen consumption has increased, fat percentage reduced, cholesterol reduced, triglyceride, LDL, VLDL all have reduced, HDL, the good cholesterol has increased. Just after 2 weeks, this is what we have been able to show. We have a very special pranayama we give them. Normally, with obese people have got the deficit in the Surya. And as a result of that, the problem comes. This is the root cause of the pranamaya kosha. What is meant by Surya and Chandra? Very interesting. That we have got in the pranamaya kosha, we have Surya Nadi and Chandra Nadi called as Pingala and Ida. Ida Nadi and Pingala Nadi. When the prana flows through the Ida, your left nostril becomes active. It's cooling in character. It cools down, calms down your mind and increases your vitality. Whereas the Surya or the Pingala Nadi, when the prana flows through this Nadi in the pranamaya kosha, it will burn up the calories, as the name indicates, Surya, the sun. And as a result, your breathing rate increases, metabolic rate increases, and the fat cells start getting burnt up. So therefore, what we have done here is to see that you breathe through the right nostril. Surya, Anuloma, Viloma, Pranayam. Very simple. Close the left nostril, breathe in through the right, breathe out through the right. 1 round. Like that we do 27 rounds. Morning before breakfast, before lunch, before evening dinner, before going to sleep. 4 times a day. 27 into 4 becomes 108. If you do that regularly, within 1 month you will reduce not less than 2 kgs. 2 kgs weight reduction automatically happens. We have done thousands of people all over the world. Such a simple thing. And in Detroit, when I was conducting this program, I said, such a simple thing, I don't believe. But I said to all these people, please write down your diary and let us watch. And when I went next year, they all came out and said, I reduced 10 kg, sir. I reduced 20 kg, sir. I reduced 14 kg. Everybody has recorded, shown this thing. How does it work? This is how yoga works at a subtle level. It is not that you have to work out tremendously. People who work out detail, you are not solving the original thing. Adi you are not solving. The breathing, the pranic imbalances you are not setting right. Once you set right, automatically this happens. Very simple technique. That's what we do in our 250 beds facility, where people come from all over the world with tremendous complications of these things. They get wonderful results. Every week it's a miracle that we see in Arogyadhama. This is the most dreaded one, and our thing started in 1986 when we had 8 terminal case cancer patients, 6 breast cancer, throat cancer and bone cancer. And all these people are burnt up. They had radiation, chemotherapy and then surgery. And Dr. Krishna Bhargava, who was the director at that time of the Kidwai Memorial Institute of Oncology, he said, we can't do anything more. We can give you only painkillers. But why don't you try yoga? That's how they were directed to Dr. Nagaratna, and we started treating them. Every day evening, they used to come for 2.5 hours. 1 hour was lecture, 1 hour was practice, and half an hour was interactions and counseling. And amazing, everybody started feeling so relaxed, so wonderfully energized. And at the end of the first month, I remember one of the breast cancer ladies, she was 36 years, maths teacher. She came and told Dr. Nagaratna, I'm feeling so good and I want to go for work. Nagaratna said, yes, you go, but go for 2 hours. Slowly build up. Don't start tensing yourself. Within 6 months, she was full steam. And all these people, Dr. Krishna Bhargava had said, you will not live more than 6 months. But all of them are living even today. Look at that date, 86. And recently when we did, about 8 years back, biopsies have shown normalcy. Only this bone cancer patient, he passed away about 5 years back at the age of 78. This was very amazing. Therefore, Dr. Krishna Bhargava said, I'm going to give you 100 patients of varieties of cancer. Why don't we teach? This is how we started our initial set, and wonderful results started coming up. All people recommended that yoga should become part of the treatment program here in Kidwai, and we started doing that. which led to our first study in breast cancer for 3 years follow-up, 30-30. And we did not measure very sophisticated things. We just wanted to see the stress levels and wanted to study the main outcome of survival. At the end of 3 years, what happened? Out of the 30 control, we had 14 people who had died and 7 people who had got secondaries, and remaining only 9 people had not got secondaries. In the yoga group, nobody had died and only 5 secondaries. Remaining people were doing fine. So this had made us to go deeper, and people started coming to Prashanti Kudiram. Within 2 to 4 weeks, they started feeling much better. And then what we started working on, how does yoga work here? Yoga works at the immune level. What happens in cancer and diabetes are very similar. Our immune system has got a great quality to find out who is an enemy, who is a friend. And in diabetes, what happens? Somehow it thinks that insulin is an enemy. Therefore, when the insulin is coming up from the beta cells of the pancreas, there is the immune system intervenes and puts an immune barrier, not allowing the insulin to enter into the bloodstream. Why this happens? Because the immune system thinks that insulin is an enemy. Exactly opposite happens in cancer. Immune system thinks that cancer is a great friend, does not destroy them. As a result, it starts growing. In all of us who don't have cancer, our immune system takes care. Cancer cells are born inside the body. Every day, 1 billion cells are born in the body. Out of that, maybe 1,000, 2,000, are not produced the way that had to be produced. They are weak cells in the body. But normally, immune system takes care of that. 1,000 is nothing. Every day, millions of cells come from outside. Immune system takes care of everything. Big war is going on inside. But 1,000 or 2,000 of cancer cells is no consequence. It will gobble up. We are all healthy. But in cancer people, what happens is it fails to gobble them up because immune system thinks that cancer is a great friend. In diabetes, it thinks insulin is an enemy. Here it thinks it's a friend. Why does that happen? Because of the stress. Because